The Ebola virus is a serious and deadly disease transmitted by animals and humans. According to Healthline, a healthcare reference organization, scientists initially detected the Ebola virus disease in 1976 in Sudan and the Democratic Republic of Congo. Researchers named the disease after the Ebola River that flows through the Congo. Ebola is a viral illness, of which the initial symptoms can include a sudden fever, intense weakness, muscle pain, a sore throat, all according to the World Health Organization. The current Ebola outbreak was first registered last year, February 2014, in Guinea, and is already the deadliest in the history of the disease. BBC states that, in fact, the current epidemic sweeping across the world has now killed 5 times more than all other known Ebola outbreaks combined. In August, the United Nations Health Agency declared an international public health emergency to attempt to halt the spread of this virus. According to the CDC, there were 2 imported cases, including 1 death, 2 locally acquired cases in healthcare workers that reported in the United States. However, the World Health Organization announced on April 22nd of this year that the decline in confirmed cases of Ebola virus disease has halted over the last 3 weeks. To accelerate this decline towards 0 cases, it will require stronger community engagement, improved contacts tracing, and earlier case identification. Despite this devastating loss due to this Ebola outbreak, it is an option, according to the NPR, that aid officials are hoping it also may address the long, festering shortcomings in West Africa's healthcare systems. Not only to begin building systems that contain Ebola, but now to improve the overall health in the long term. Community health workers, local providers of basic and sometimes life-saving medical care, are starting to fill the gap, says NPR. The Ebola response has leaned heavily on these workers, with foreign militaries training hundreds of people in basic healthcare and Ebola response by the week. U.S. Agency for International Development Chief Dr. Rajiv Shah expects that the outcome will be thousands of trained community health workers that should be able to power a community-based health response in West Africa for years to come. This is very optimistic news for the United States as well as the rest of the world for the future.